And I think Amy did a very good job of giving a deep down view from the perspective of technology, what the challenges are with the different models. And she talked about the federally facilitated exchange and the state partnership model. We're going to focus here on the state-based exchange, where the state is taking over all the core functions that she mentioned that exchanges have to do. Now, one of the biggest challenges is the tight timelines. I know this is a technology conference, but there's a very similar conversation happening on the policy side in all these states. There's a lot of policies in the state level that have to be updated to comply, figuring out how you're going to change your Medicaid program, whether you're going to have a basic health plan, how you're going to go through the process of qualifying health plans, what the role of the exchanges are, the legislation, all that kind of stuff. But so there's a lot going on the policy side. And on the technology side, this is a pretty heavy lift. Those of you, I think a lot of people here have been involved with MMIS developments, but to think about building whole new systems for states that include MMIS changes and eligibility enrollment changes, plus all the things for a modern exchange shopping experience, that takes more than 12 or 14 months. And one of the biggest complications is this expectation, which I think is a wonderful concept, of the exchanges integrating Medicaid eligibility and enrollment with the commercial insurance exchange. And I think people have talked about this, and it's been covered a couple places, but this is really, I think, the nubbin. My son is a IT guy, and when I first told him about this grant that the Massachusetts had gotten $45 million to build an exchange, and what it did, he says, gee, me and my buddies could build that in a weekend for $15,000 and a lot of Dr. Pepper, you know. But I think it's this nubbin, the complexities about the way the law is written and the way the regulations have evolved, about integrating with federal systems to do real-time eligibility, integrating with IRS data and all the other systems you have to integrate with that add the complexity and make the timelines even tighter.